Men don't do surgery.
They want to get procedures done. They're not even scared of talking about it anymore. Be it gynecomastia, called as man boobs. They come in for hair restorations, jawline corrections, name it, and they're up for it. Celebrity is just the tip of the iceberg.
What is the most sought after celebrity face that comes to you? I want to have a face or body like her.
We can get you to the better version of yourself, not to look like a certain celebrity.
Plastic surgery as a math or plastic surgery as an art?
It's a mix of both, but I would say it's an art.
Botox or a nose job when you talk about plastic surgery? Think again. Today we have Dr. Vidhi Mehta who's here to debunk start with the biggest myth. Men don't do surgery.
Oh, that's changing so fast. We see so many men who actually come into clinic, and they want to get procedures done. They're not even scared of talking about it anymore. Be it gynecomastia, called as man boobs. They come in for hair restorations, jawline corrections, name it, and they're up for it.
Is celebrity an ideal candidate or now there is more to it?
Celebrity is just the tip of the iceberg. We see most commoners come in for a tiny little procedure, from like very little thing to getting a Botox or a filler, or to getting, to almost getting a big surgery done like rhinoplasties, breast surgeries, abdominoplasties, everything. And people are openly talking about it.
Which is true, because in India, the average age of getting a procedure done has gone down to as low as 20, which was 30 in the past decade. So do you think this is a good thing? Do you think there are associated risks with it? Can you tell us more?
I think with the rise of social media, the whole culture of comparing people to what you see online has really catalyzed this early age that we see people coming in. I think what we need to understand is the motivation behind why they're getting the surgery done. If you feel that it is for a slight change, you think that may help them with confidence, it's fine. But if they feel it's something that might help them in their career, if they're going to save a relationship, I don't think that's the right motivation to get a surgery done. Also, we need to make sure they have very realistic goals, because when you come in with unrealistic goals and chasing perfection, you are never going to be happy.
What is the most sought after celebrity face that comes to you? I want to have a face or body like her.
Kendall Jenner?
Do you think it's possible to have a Kendall Jenner
No.
in reality?
No. We can get you to the better version of yourself, not to look like a certain celebrity. That's unreal.
Great. What do you think about the trend of lip fillers that is going on? Are you pro, neutral, or against it?
As long as you're not overfilling the lips, it's good. I think in the past few years, say past 2 to 3 years, it has come down to natural looking lips versus what earlier people wanted, overfilled lips. I think that's better.
Can you tell us more about dermal fillers?
We use fillers to prevent the aging look, that whole sloppy look that you have to the face. So a lot of the times the fillers are used for that. It can be artificial fillers, or we also use fat graft for filling the face, which has a lot better results because it also has stem cells and skin rejuvenating capability.
All right. So is this something to do with boosting confidence, or is it something something psychological? How do you differentiate? And have you ever said no to a patient coming to you?
Yeah, that's a good question. So surgery can help you enhance your confidence for sure, but it's not going to build your self-image. So if that is your goal, I think that's where you need to psychologically consider other problems, and yeah, we do always refuse patients if they've come in with the wrong motivation, if they're chasing perfection, if they're chasing unrealistic goals, if they've come in with very unrealistic expectations of how their life is going to be after the surgery. It's not going to fix your life, it's going to make you feel better about yourself for sure.
What are the, say, top 5 unrealistic demands that have ever come to you?
Say you want to look like a particular celebrity or actor or an actress, or say you want to look like some influencers. So many influencers on social media these days. Yeah. Really unrealistically thin noses, which is not very culturally possible in Indian scenarios, not all the time.
Yeah.
Say you want to look really, really thin and snatched.
Yeah. Let's talk about thin now. I don't know if I should get a tummy tuck or a lipo or both. So, how would you guide me in this scenario?
So, liposuctions, tummy tucks, how we call it abdominoplasty, they are not weight losing surgeries. They are just tailoring your body to look a certain way. So, once you've gone through your weight loss process, either through a bariatric surgery or through natural processes, what we do is go in and make your body look a little snatched. Now, what is the best procedure is something when you consult your plastic surgeon, they'll be able to help you best with what is going to give you the best results. So if you have excess skin, then, we want to go in for some tummy tuck or like arm tuck or a thigh tuck. And if you have a lot of fat, we can get liposuction done and club it with the other procedures.
What are some of the riskiest cosmetic procedures?
I think everything is safe as long as it's done in the right hands. We see a lot of the times patients are chasing low-cost surgeries which are done by quacks, with not proper qualifications. So I would really suggest people go in and check the qualification of the surgeon that they're getting operated by. Sit with them, try to understand how they are going to be able to help you, and then take the decision.
What are the top contributors to aging?
All the vices, all the vices that we always name: smoking, alcohol, sun exposure, bad diet, not enough exercise. Of course, genetics does play a huge part in it, but the rest is something we can control.
Do you think metros are more susceptible to causing faster aging than?
Potentially, for sure, because we are exposed to a lot of pollution.
How do I protect my skin when I'm out in the sun or I'm traveling? How do I prevent the factors that you mentioned?
Very simple measures. Make sure you cleanse your face, moisturize it, use sun protection, SPF 30, 40, whatever works, and protective garments like a cap, a scarf, or a jacket. That's good to begin with, and good nutrition and hydration.
Can you tell me top foods for best nutrition and my skin?
All your leafy vegetables, fruits, water, cut down on sugar, and any processed food.
Got it. So let's talk about processed food. While we talk about processed food, we also talk about, junk food disguised as good food. Okay, and we talk about a lot of pizzas now in healthier options, or maybe like breads in healthier options. How would you recommend that?
Avoid it. Taper it down to say once a week. You don't want to completely give it up, but you want to reduce your consumption.
Got it. Talking about consumption, smoking or drinking, what would you rate worse?
Smoking.
For
I
skin?
think so, yeah.
Got it. So, say I am a woman who has an active lifestyle, who's out in the sun, who's also eating right, and kind of trying to balance it all. And when am I an ideal candidate to go for a plastic surgery?
So it also depends on what sort of plastic surgery are we talking about here. There can be some minimally invasive surgeries or procedures, how we call it, can be skin rejuvenation. All those you can start by, say, around the age of 30, 35. And say if you're talking about anything like a facelift or a tummy tuck, that would be a little later in life. But I cannot sit and tell you that, okay, this is the right age. Beyond this, you cannot do a certain procedure. It's very customized to every patient and every need, every sort of disfigurement we are dealing with.
Great. So is 50s too late to start getting into cosmetic procedures?
It's never too late.
When we talk about cosmetic surgeries and starting early, what are the risks associated with it?
I think it has a maintenance phase. So the sooner you start, you have to make sure that you are going to be keeping up with the maintaining schedules of all of those procedures, and that you take care of whatever advice that you've been given after the surgery, because it's not just done and you're out and about and you're going to be good. You have to make sure that you are keeping a healthy lifestyle after and follow up.
Great. So what is the downtime for surgical procedures ideally?
So, okay, this is something that not many people talk about. And when you see on social media, people believe it's just in and out and you're good. But this is something that is very, very important to talk about before you go under the knife. So, the recovery can be anything between 2 weeks to 4 weeks, depending on what procedure you've gotten done. Your scar takes a while to mature. You are in pressure garments for a certain amount of time after procedures. There can be swelling, bruising, all of that is something that you need to account for before you go under the knife or make the decision that you're getting the surgery done.
Talking about surgeries, implants are also highly talked about surgeries. And what is an unrealistic expectation versus when can I get an implant done?
So when we're talking about breast implants, Indian females more often than not want a reduction versus an augmentation.
Yep.
So we see many people in their 20s, early 30s who come in for a reduction because they want to look a certain way, they want to wear a certain sort of garment versus an augmentation.
Yeah.
But when we're talking about breast implants, yes, people do ask for them. A lot of the times there's a mismatch between the breast and they want to get that, into symmetry. We would advise not going really, really big because it can have other complications, but it's case-to-case basis.
Okay. So what are some complications that might arise when I get an implant done? And how much important is the weight of the implant?
Usually we get the implants based on the size of the other breast, or even if you're getting both implants done, the body shape or the body size that the patient is. And if we go too big, you risk skin necrosis, seromas, hematoma, something which we normally see in other surgeries but far lesser.
Got it. We also talk about, loving oneself as we are. And then we also talk about, taking help from certain procedures to get better, to get a better version of themselves. So where are you at? How would you recommend people to balance it out?
I think humans are wired for self-improvement. I think you need to understand where it's stemming from. Is it coming from the growth mindset? Then maybe go for it. Yeah. If you are coming in from some sort of insecurity, then I think we need to look into what else is the problem here and then deal with it alongside with the surgical procedure. I think it'll help you build confidence when the cause is dealt with.
Talking about causes dealt with, let's talk about women and post-pregnancy. What are the most common procedures they opt for?
A lot of the times post-pregnancy, women really miss their old pre-pregnancy bodies. And once they have lost their weight, say in a couple of months to 1 year, they feel that flabby, nature to their body. So they want to probably get mastopexy, that is something like breast surgeries, or they also get abdominoplasties. We call it the mommy makeover. So it is like breast surgeries along with a tummy tuck. So that is a lot of the times we do see people come in for that. But we do advise them to finish their entire pregnancy family planning, and after that get it done.
Okay. Understandable. But let's get to the fact where in the US, it's noted that 80% youngsters are getting inspired through social media. And can you just tell us something about how safe this is?
Most procedures are very safe
Yeah.
when done in a safe hospital, done with under safe conditions. It's a qualified surgeon, and when the surgeon has really examined you before, understood your history and your goals and expectations from the surgery, we are not looking at anything massive. But we would also suggest not getting multiple procedures done at the same time. It's better to stage it.
Got it. Can you just recommend me when do I see a dermat versus when do I see a cosmetic surgeon for my face?
Right, that's a good question. So, dermat will help you with a lot of conditions apart from cosmetic issues as well. They are very good with dealing with any other skin condition. Versus when you want to get any minimally invasive procedures done, anything surgical done, a plastic surgeon is your best choice to visit.
Got it. Okay, there's this much hype and much trend going on about vampire facials and hydra facials. Can you differentiate between the two, please, for us? This has been doing rounds and breaking the internet.
Okay, so vampire facial is somewhere where we use your own blood to, we get your growth factors out from your blood and then, it's injected back into your face. So it helps in rejuvenation of your skin, makes you look a lot younger. Your skin looks healthier over a period of time. Hydrofacial is something that's going to improve your hydration. Both procedures need multiple sessions. You're not going to have results which are going to be really, really sustainable, but they do help.
What are some of the other fads people are considering which you would not probably recommend?
Nothing per se that people are pursuing that I would not recommend as long as they're getting it done in a very safe place. But overfilling the face, having very unrealistic expectations with, I want to look a certain way, I think you're good as long as you're in safe environment.
Some surgeries that you could just pass, like probably the eyebrows or something?
People who actually come in for eyebrows are, who've had some cuts or some loss of certain sense. So we do a hair transplant for their eyebrows, and then they look a lot better actually.
Oh, is it?
Yeah.
Lovely. So, what are the top 5 things that are most common when it comes to plastic surgery that people get done most?
So people are really getting hair transplantations done. People are not willing to look a certain way when it's not about their hair. A lot of women are getting breast surgeries done, be it augmentation, reduction, just a lift. A lot of the people are coming for liposuctions. It could be just one part, just the arm, just the back, just the love handle or a thigh. People are also getting a lot of, very tiny fillers, just one part of the face. Such small procedures also people are coming in for.
Botox still remains one of the favorite and the most sought after procedures in the world still. Do you see anything else taking it over?
Skin stimulators, biostimulators, a lot of fat grafting. Yeah.
Good. Let's talk about reconstructive surgery. People just know cosmetic surgeons as somebody who enhances somebody's beauty. And I believe there's more to it. Can you tell us more?
So, a fun fact, plastic surgery, the word plastic comes from the word plastikos, which is a Greek word which means to mold. So, plastic surgery is something where we do a reconstructive surgery or reformation, transformation in a certain sense. So, aesthetic surgery is a part of it, and we do a lot of other reconstructive surgery, be it post-trauma, post-cancer, any sort of industrial injury, a lot more.
What is a perfect face like? What are the tools that you use to measure a perfect face?
This is something. This is a myth, where you want to have a perfect face. This is something that we try not to chase. We want people to look like themselves, maybe a little better version of themselves. Of course, there is the golden ratio. We divide the face into 3s and we divide the face into 5s. There's a lot more mathematics to it, but at the end of the day, it's what looks good.
Yeah.
Is what is going to look the best, not chasing that perfect number.
Beauty standard. That is correct. So, plastic surgery as a math or plastic surgery as an art? Your choice.
It's a mix of both, but I would say it's an art. A mix of art and surgery.
What took you there? Why plastic surgery?
I think I was very sure that I wanted to do something surgical when I began my medical education. And as I explored more and more, went to more rotations, I saw this branch had a chance to change people's life in big ways,
Yeah.
be it reconstructive surgery, be it aesthetic surgery. It was life changing. So there's something that I got into.
So Dr. Vidhi Mehta is an expert. She's a consultant at KEM and all of that. But what are some things that you learned that textbooks never taught you about plastic surgery?
The patients and their stories. That's something that you cannot read from the books. It's only when you spend time in the wards and listen to their stories, and they will tell you a lot more, and you will learn through their journey, through their trauma, through their recovery. You learn a lot more.
What is one of your favorite stories that has stayed back with you?
A lot, but I would say a lot of my burns patients, they have the most heart-wrenching stories, and how they got burnt a lot of times, they're homicidal, and how they survive the whole recovery journey, get back into the society and make a life for themselves. I think it's brilliant.
Have you ever said no to a plastic surgery, that no, I wouldn't recommend that? And how often is that?
Quite often, actually, when patients come in with requests which are not very optimized, or when they are chasing something that the surgery is not going to be able to deliver, we say no. That would be, let's just say it's around 20 to 30% of the times when we know we cannot do justice to what they want, or the surgery is not going to be the best solution, we do refuse. There is a dictum in medicine which says, primum non nocere, first do no harm. So
Yeah.
we don't want to harm the patient, even if we can't help the patient.
Let's talk about teens. Do they come with insecurities, and do they come at all to your clinic?
Not as much, as many as the 20s come in. But the teens which usually come in are with some sort of congenital anomaly. They have something that they're born with, some other conditions.
Got it. So when we talk about 20s, what are the procedures that they come with, requests that they come with often?
Chemical peels, they want to get some scar revisions done, they want to get their tattoos removed, they probably want a little bit of a lip revision done. Very minute procedures.
Okay. Rhinoplasty or nose job is one of the most popular procedures done in India. And but there's also, as much as we talk about it, there's also taboo around it. And who should get it done, and why should we get it inspected? Why is it also important? And is it just cosmetic?
It's not. A lot of the times when we do nose job or rhinoplasty, as we call it, it's for medical reasons. You can have like a deviated septum, you've had any previous surgeries or any previous accidents because of which you have a deformity. So we do correct a deformity. A lot of the times it's aesthetic, where people are just wanting slimmer noses to look like a certain person, with the Barbie nose, or a lot of those other things. Yeah. So there can be multiple reasons why you're getting it done. It's pretty safe, but you have to have very realistic expectations when you get a rhinoplasty done, and also to remember that it does have its downtime.
Got it. We shift to the eyes. A lot of them, more than eye surgery, eye correction, people are also worried about the eye bags, and they get a lot of procedures done. So what are the top 2 or 3 recommendations that you could give somebody with very deep eye bags?
So when you are starting out with very little discoloration or hollowness, you can see a surgeon early on, and there can be minimally invasive procedures, which can be some sort of filler, or it can be some fat grafting if there's hollowness, or if there is, once you are a little older, you might need a surgery called a blepharoplasty, where we go in and rearrange your fat which is around, so as to look for it to look fuller, and we remove the excess skin which is there. It's very catered to what the person needs.
Oh, you mean to say it's tailored to one's needs, and it's specific, different to every individual. Got it. So let's also talk about when I need microneedling versus when I need a Morpheus, because that's doing a lot of rounds. Also help us differentiate between the two.
Microneedling is where you go in and have multiple micro punctures in the skin, which helps stimulate regeneration of collagen, which helps your
Correct.
skin become more firmer.
Yeah.
Morpheus is a type of microneedling where you are going in with a microneedling probe. What it also does is the tip of those probes go in and radiate some radio frequencies which help in tightening of collagen. So you have to make sure you're doing it at the right depth, because if you go deeper, it might also lead to burning of your fat, facial fat, which helps in maintaining the youthful look of the face.
Got it. Say there is an ideal case study where there's a 40-year-old woman with mildly sagging skin. What would you recommend? Microneedling versus CO2 laser?
We usually do a mix of a lot of different procedures. It's not one procedure. So usually a series of procedures have been lined up. So maybe you start with whatever is the need for the patient. So we start with microneedling. Maybe we go in with some sort of fillers. Maybe we do some sort of chemical peels. It's a mix and match of both. Again, tailored to the patient's needs and what their face is like at the time.
Got it. Face tight and neck tight are also really popular. When and who should get it done?
When you have little sagging and not a lot.
Yeah.
So when you have significant sagging, which is say in your latter 40s or 50s, then a surgical facelift is a good idea. But say you are in your late 30s, early 40s, so you can probably go in for a face tight or threads, which are going to give you some results, but they're not going to be equivocal to what a surgical facelift is going to give you.
Also, can you help us about lipolysis? What is it and why is it doing these many rounds?
Now you're talking about the
non-invasive. The non-invasive.
Yeah. So a lot of the times we use those injections for lipolysis, most often used for double chin. So for neck contouring without actually going in and doing any surgical procedure.
Got it. Is it effective?
Yeah, it sure is. Yeah, it is.
Got it. So can you just help us about, for example, I'm a man, I have my insecurities. What are the taboos that I must break and visit you?
It's completely okay to have insecurities. Number one, need to accept that. Secondly, if you feel that addressing them is going to make you feel better about your life, then for sure need to visit a plastic surgeon. Thirdly, getting a procedure done is not going to change how people look at you. So that is another thing that you have to get over. And if you feel that you don't want to talk about it, maybe you can keep it a secret. But everyone is talking about it now, more so with social media. And people actually get their friends the next time they come for a consultation.
Wow. So who comes to your clinic more for a hair transplant? Is it the men or is it the women?
It's the men. It is the men in their 30s and early 40s who have a receding hairline and they want to cater to it.
Is it now an open conversation, and how open is it, and how do you deal with somebody who wants to get it done but is insecure about it? How do you conversationally get into that?
I think there are people who are very open about the fact that they do want to look a certain way and be perceived a certain way. So they are very open to getting a hair transplant done. But again, like you mentioned, a few people are scared, what will be the procedure like? Or do I really want to get it done? How much it would cost? What's the recovery like? So we kind of sit down, have a conversation, talk to them, explain the pros and cons of the whole procedure. Probably sometimes they are convinced, sometimes they're really skeptical about it.
People are getting procedures done in as little as 2,000 or 5,000 rupees. What do you have to say about that?
Are you sure you're getting it done from certified doctors? Please check that, because you do not want to land up with a complication. Yeah. You rather be sure that what you're doing is safe and that's actually something that you are in need of, rather than just being sold because it's costing just a little bit.
Yeah. Have you ever corrected something that a badly done surgery come to you and then you've corrected it? And can you just help us with an example?
A lot of times people come in with previous surgeries done, and the most common is scars. People come to get their scars revised because they've not been done in a certain way. They look ugly. So we cannot completely get rid of the scars, but we can help you with it looking almost like 80 to 90% better eventually with revisions and other procedures.
why is it that some of these celebrities are not looking good the way they used to look? And how do you like to express that?
One overfilled faces. Everyone is trying to look a similar body type. Everyone's chasing just one ideal versus what previously people would look like themselves. I think that is something that is quickly changing and not in the right direction.
Who ideally should choose plastic surgery as their career, according to you?
Somebody who is inclined firstly towards surgical medical branches, somebody who enjoys art, and who's ready to work the odd hours, middle of night, and somebody who enjoys every case being a different puzzle and then something that you'll enjoy solving.
While we talk about the fun and the enjoyment and everything that comes with helping somebody look really nice in your profession, what is the hard part of it? What were your challenges? Tell us more about that.
Okay, the challenges. The first part could be a really, really long education journey.
Yeah.
It takes you
Sure.
13 to 15 years to get to becoming a plastic surgeon in India.
Sure.
That comes with two residencies, which can be insanely difficult, and it can be hard. It can be a lot of night duties. After that, you are dealing with a lot of patients who are post-traumatic, and then their stories can sometimes be overwhelming. And more often than not, we are not kind of pulled down by it, but they do somewhere leave a mark in your mind and heart. You do have to make sure that you are really, really happy about doing a plastic surgery, because it's going to take a lot away from your life otherwise, and you have to be able to dedicate your time and energies into this practice.
Right. So, what is the most fulfilling moment of being what you are as a professional?
It definitely has to be time when the patient comes back with a smile and they've recovered and they feel very happy about what their journey has been by far, and how they're going to get back into society and it's going to change their life.
Thank you so much. I think we'll wrap this session with this. It was so much fun and so good understanding that it is not about just selling insecurities, but also selling smiles. So know and balance between the two is what we've learned. And Vidhi Mehta has been all out there mystifying and debunking all the myths that you might have. So visit her and understand what needs to be done just before coming in and asking her to get a vampire facial done. Thank you.
Thank
That's
you so
my
much
time.
for having me.
Thank
It was
you.
so fun.
So fun.